Dr. David Rastel, here to give you lecture number 1 in efferent neuro-ophthalmology, diplopia. So, diplopia or double vision is a really awesome neurologic problem. In this lecture, what we're going to go over first is how to localize where the lesion is that's causing the double vision. Then, for each of those locations, we're going to go through and populate it with diseases so that you know first where to find the lesion, and then second, which diagnostic test you need to run to successfully diagnose the disease, and finally, how to treat the disease. In neurology and in diplopia, everything is location, location, location. So the first thing we're going to do with diplopia is talk about localizing the lesion. So when we localize the lesion, the first question I want you to ask every diplopia patient, and you could get this on a test question, it could say, what's the first question to ask? You'd say, well, I ask all these things. No, the very first question you ask is number 1, is the diplopia monocular, meaning involving one eye, or binocular, involving our binocular vision using 2 eyes to perceive the world in 3 dimensions? This is the super important question that we have to ask with diplopia, because binocular diplopia is going to end up being a neurologic problem. This is a brain, as you can tell I was previously a professional artist. And monocular diplopia is going to end up being within the eye, as in you need to consult ophtho. So what do I mean by monocular or binocular? Well, when a patient comes in and they're complaining of double vision, you're going to ask them, does it go away when you cover one eye? Binocular diplopia, the principal topic of this conversation, is going to occur when you have 2 eyes that are looking in different directions. Because they're looking in different directions, each eye is seeing something different. This eye is looking over here and seeing a sea monster. This eye is looking over here and seeing a vat of pudding. You're seeing 2 things. Monocular diplopia is when you cover one eye, this eye is still seeing 2 things. So it can't be because the eyes are misaligned. It has to be because there's a problem within this one eye. And what's happening specifically is you have your retina back here, and the light must be getting split within the eye and hitting 2 places at once. So monocular diplopia is always going to be a problem within the eye, not a neurologic problem. The most common cause of monocular diplopia, as in the patient covers their eye and they say, I still see double, is going to be dry eyes. And when you see these patients, they'll frequently say, oh, well, I've already tried eye drops, they don't work. Well, they need to try the eye drops 4 times a day for 2 weeks to really rehydrate their eyes. That's the most common cause. There are other problems. Anything within the eye can cause monocular diplopia. So after the patient says they have monocular diplopia, it's not a neuroconsult, it's at worst an ophtho consult. So the rest of this lecture, we're going to be talking about binocular diplopia. Diplopia that goes away when they cover an eye and only comes out when both their eyes are open because both the eyes are looking in different places. And when we talk about binocular diplopia, we need to localize the lesion. So there are 6 places the lesion can be. We know that the eyes are looking different places. So the first thing that could cause the eyes to look different places is fairly simple. The eyes sit in the socket, and within the socket, there could be a lesion. Common causes of lesions in the socket include trauma, tumors, or anything else that gets inside the socket. These lesions will present in a very specific way. So, number 1, we could localize into the socket. it'll simply be one eye cannot move in one particular direction because something is physically restraining it or the muscles that move it. Number two, each of these muscles themselves can have a problem. We'll be going over some diseases that can cause problems in the muscle, or again, it can be trauma. Three, each of those muscles is going to be innervated by a nerve. And for that nerve to communicate to the muscle, it's going to release neurotransmitters. So three, there could be a problem with those neurotransmitters at the neuromuscular junction. Four, and the one you guys will probably be most familiar with from medical school, there could be a lesion in the nerve itself. There are only 3 cranial nerves that control eye movement: cranial nerve 3, cranial nerve 4, and cranial nerve 6. We'll be going over each of those in a little bit. It could also be in the nucleus, the origin of the nerve. And because the nuclei communicate, this will be the cranial nerve 3 nucleus. This will be cranial nerve 6. We'll go over this in a little bit. Because they communicate, it could also be intranuclear. And it could be above the brainstem, above where the nucleus is located, supranuclear. Those are the possible locations for a lesion that's causing eye movement issues, an efferent lesion. Next up, we're going to talk about each of these locations. What do you need to screen for?